For the first time, India has crossed the 2 lakh mark. I'm talking about 2 lakh COVID cases in the last 24 hours. This is the largest daily tally that's been reported so far as coronavirus cases are concerned. This is the data that's been put out by the Health Ministry. 2,739 cases have been registered in the last 24 hours, along with 1,038 deaths. This is the 5th straight day of the country seeing over 1.5 lakh new cases and the 9th straight day of over 1 lakh cases. While United States took 21 days to reach the daily count of 2 lakh cases from 1 lakh per day, India has reached that grim milestone in just 11 days. The unprecedented single-day spike in India has taken the total number of cases to over 1.4 crore. Maharashtra, Chhattisgarh, Uttar Pradesh and Karnataka are among the worst hit states. India has been the world's worst hit country since April 2nd, and this is in terms of daily cases. If you look at overall cases, we are now the 2nd worst hit country in the world. Let's focus now on what's happening in the national capital. Delhi is now the worst hit city in the country, having surpassed Mumbai in terms of daily cases being reported. Over 17,000 cases that Delhi's reported in the last 24 hours. Chief Minister Arvind Kejriwal also has been holding a series of meetings today, and the Delhi government is likely to go ahead and announce a weekend curfew. Sources say that the announcement is likely to be made by the Chief Minister himself. This comes as Kejriwal met with the Lieutenant Governor this morning to discuss the ongoing COVID situation. He's scheduled to hold another meeting at 12 p.m. which will be attended by the Delhi Health Minister and the Chief Secretary. Delhi has recorded, as I mentioned, over 17,000 cases. To be specific, 17,282 cases in the last 24 hours. Making it the worst affected city in the country. The positivity rate in the capital is 15.92%. 104 deaths were confirmed in the last 24 hours. To curb the surge in cases, a night curfew is already in place in the capital since last week. There have been no restrictions so far announced in the daytime. So at 1 o'clock, Kejriwal will be holding a news briefing where we're expecting some details of exactly what kind of restrictions his government could impose in the coming days. What we're hearing from our sources is that there's a strong likelihood that Kejriwal is going to be announcing a weekend curfew, a weekend lockdown in the national capital. Now that is what we understand has been discussed so far in the meetings that he's held. At 1 p.m. we will perhaps get more details from the Chief Minister on exactly what kind of curbs are going to be put in place in Delhi amid these rising cases. Aishwarya Paliwal is joining us live from Delhi with more details on this. Aishwarya, just give us a sense of what you're picking up from your sources on what the Delhi government strategy is going to be to control this surge.
Well, from what we are understanding at the moment, Akshita, the Delhi government is looking at putting a lockdown, a weekend lockdown, which will start from what I am understanding at the moment, Friday night and will go on till Monday early morning. Now, the reason why the government is looking at doing so, because they believe weekend is the time when a lot of people move out, a lot of gatherings take place. Now, let me tell you, if they go for a full lockdown, and this is something which has been discussed internally within the government, it will have a lot of economical ramifications also. We did see the economy take time to come back on its feet. They do not want to disturb the recovery on the economic front, but they also understand that the numbers are rising rapidly. The infrastructure is crumbling, because of which a solution was being discussed, and that's what is also being discussed in the meeting right now between the LG and the Chief Minister. And 1 o'clock is the time, from what we are understanding, Arvind Kejriwal will come out and in most likelihood will announce a weekend lockdown. Akshita.
Okay, so that is something we'll be tracking very closely. Less than an hour to go for Kejriwal's news briefing. Delhiites are wondering what really the Delhi government has planned to ensure that the spread of the virus is arrested. We'll know at 1 p.m. Aishwarya, thank you for joining us with those details. Now, as we get you the latest updates from the national capital on the number of cases, what's also very worrying at this point is how the healthcare infrastructure seems to be crumbling under the weight and pressure of the second COVID wave. We conducted a reality check in some of Delhi's top hospitals. This is India Today's special investigation team on the ground to find out whether people were getting the necessary medical care. Here's what we found.
A view of the national capital's fight against COVID-19. Crowds of suspected corona patients wait for hours to get tested. This as cases break previous records in Delhi. Sitting on the sideways, on the floors, lying on the ground, in close proximity. Some with masks slipping down their noses, some without them. Facing impatient guards. A grim situation at the hospitals run by central and Delhi governments and municipal authorities. The main lobby of the Dr. Hegdewar Hospital, it's 2 in the afternoon and suspected COVID patients are waiting for test reports. Positive cases are called out, are handed reports and told to go back home.
रिपोर्ट पॉजिटिव आ गई। कौन सा कराया था टेस्ट? और ये ऐसे ही बांट रहे हैं सबको भीड़ में पॉजिटिव की रिपोर्ट हैं? क्या बोला इन्होंने?
कह रहे पॉजिटिव है।
और अब क्या हॉस्पिटल में भर्ती करेंगे? क्या कर रहे हैं?
अभी बोले घर जाओ।
पॉजिटिव है? पॉजिटिव है?
हाँ,
क्या रिपोर्ट क्या है? पॉजिटिव है? हाँ? पॉजिटिव रिपोर्ट आई है? पॉजिटिव रिपोर्ट आई है? पॉजिटिव है।
That's how confirmed cases walk out through the crowds. Overwhelmed, the staff on duty feel helpless.
आप ऐसे बांट रहे हो, लोग बैठे हुए सोशल डिस्टेंसिंग के लिए, कोई सोशल डिस्टेंसिंग नहीं है, कुछ नहीं है। और इससे और लोगों को हो जाएगा, नहीं होगा, और लोगों को नहीं हो जाएगा।
The situation is no different at this hospital run by Delhi's municipal authorities. Long queues of suspected corona patients. It's so crowded, there's no room for social distancing. Mothers with newborns, pregnant women wait endlessly for testing.
6 बजे से यहाँ तक आए।
कहाँ से आए हैं आप?
मंडोली से।
और अभी सुबह 6 बजे आ गए थे?
हाँ जी।
चले जाओ 10-15 और अब 10:30 बज रहे हैं।
अब देख लो क्या 257 अमित। अरे 257 अमित कौन है? 257 अमित। 263।
Some patients who have tested positive have just disappeared in the crowds.
263। नंबर बताओ यार, अपना नंबर बताओ। पॉजिटिव रिपोर्ट है मेरे हाथ की, अब उनको ही बुला रहा हूँ, रिपोर्ट बांटने नहीं आया।
Testing facilities are equally overstretched at the central government's RML hospital.
कल सुबह आए टेस्ट के लिए। कल सुबह आएगा टेस्ट के लिए भैया, आज नंबर नहीं आ पाएगा। क्यों? भैया 1 नंबर आपका है, 50 चल रहा है अभी, 2:30 बजे बंद हो जाएगा, इसलिए नंबर नहीं आ पाएगा, इसलिए मना कर रहा हूँ।
A cruel irony if healthcare facilities turn into potential breeding grounds for transmission. With Nitin Jain and Jamshed Khan, this is the India Today's Special Investigation Team.
lockdown that was imposed by Chief Minister Uddhav Thackeray. Now, a number of essential services are all functioning normally, and that is very clear from the curfew guidelines that have been given, and things have largely been smooth in the last few hours of the curfew. So the entire state is under strict curfew for the next 15 days. Public transport, grocery shops, ATMs, petrol pumps, home delivery of food is allowed during this period of time. Places of worship, malls, you've got cinemas, salons, beaches, schools, colleges, all of that is shut. Maharashtra has reported 58,952 new cases in the last 24 hours. With the surge, active cases in the state has breached the 6 lakh mark. 278 deaths have been reported in just one day in Maharashtra. Breaking that down further, Mumbai has seen a huge surge in its COVID tally. The financial city has reported 9,925 new cases and 54 deaths in the last 24 hours. So those numbers are worrying, but unfortunately Mumbaikars are not taking the situation seriously. Here's a report that's been filed from the Dadar market, which shows how people are flouting COVID norms.
Break the chain restrictions have been implemented in Maharashtra and particularly in Mumbai. We are at a police checking point in Baijal where vehicles are being stopped. People are being asked as to why they have stepped out, because non-essential services are not allowed to make movements in this restriction which has been implemented from today till May 1st. This is statewide restriction which has been implemented, and hence at various places in Mumbai this checkpoint has been created at locations so that movement of non-essential services does not happen during the daytime or in the night time. This is important because the rising number of COVID cases and deaths due to the COVID cases, it is important that the movement of people is stopped so that things can be controlled. With camera person Mangesh Ambre, Mustafa Sheikh in Mumbai for India Today.
And Chetin Arora now explains for you the difference between last year's lockdown and this lockdown, this curfew that's been imposed now in Maharashtra.
We're talking here about Maharashtra lockdown 2.0 and what is allowed, what is not allowed. While the Chief Minister says that it's not a lockdown, there are several restrictions in place that make it like a lockdown 2.0. Earlier, you had transportation, which was disallowed. Now it is allowed for essential services only. And street vendors earlier were not allowed. Now they're allowed, but only for takeaways. E-commerce, earlier not allowed, but now allowed only for essential goods and services. As far as marriage ceremonies are concerned, earlier they were not allowed, now allowed with 25 people only.
There's another serious concern that's risen across the country in different states, and that is with regards to testing facilities. They're hugely overburdened, and that's why people, any of us, try to go out and get a test done. You need to book an appointment 3 to 4 days prior, and then the results are now taking at least a couple of days to come out. All of this has led to a big question mark on the fight against coronavirus, because the most important step of testing is not being followed promptly.
As each day passes, the situation in Mumbai is only turning grimmer. Hospitals are bursting at the seams with patients, but there is another vital cog in the health system that has been stretched beyond limits. Labs are battling to cope with the numbers of test samples that are coming in. The RT-PCR test results are taking 2 to 3 days. Some labs have even stopped the sample collection. India Today's Mustafa Sheikh posed as a patient and called a sample collection center in Andheri East. And this is the response that he got.
टेस्ट कराना था सर, घर पे आके कर सकते हैं आप लोग? जंबो दर्शन के पास रहते हैं सर, अंधेरी ईस्ट। आरटीपीसीआर टेस्ट। बंद मतलब सर?
रिपोर्ट बहुत डिले हो रहा है सर। संडे का सैंपल यहाँ से गया है।
हाँ। अरे बाप। संडे का सैंपल अभी गया है आप?
संडे को कलेक्ट किया हुआ सैंपल मंडे को दोपहर को गया, अभी तक रिपोर्ट नहीं। तो हम लोग पेशेंट को जवाब नहीं दे पा रहे, सामने से कोई फोन नहीं उठा रहा है।
Testing centers say they are facing shortage of PPE kits and even testing kits.
ये पहले हमको फ्री मिलता था, आज इसकी मार्केट वैल्यू 50 रुपीज है पर किट। हमको खरीदना पड़ रहा है, जबकि ये लैब वाले हमको खुद देते थे। आज हमको लेना पड़ रहा है। मुझे कलेक्शन करने का था आज न्यूज चैनल में जाके, तो कल से मैं पीपीटी किट का नहीं कुछ जुगाड़ बंदोबस्त हो नहीं पाया, तो आज कैंसिल हो गया वो अपॉइंटमेंट।
Several testing centers are giving priority to symptomatic and comorbid patients.
क्योंकि नंबर ऑफ पेशेंट्स बढ़ेंगे तो हमारी जो काम करने की कैपेसिटी है वो हिसाब से डिले होगा ही। तो भी उसमें से भी हम जिसको अर्जेंसी है, फिर जो प्रेग्नेंट है, प्री सर्जिकल है, और ट्रैवल के लिए जिसको इमरजेंट जाने, स्टूडेंट्स है, वो सबको हम प्रायोरिटी देके उनके रिपोर्ट आज की तारीख में 24 घंटे में दे रहे हैं।
Due to increase in cases, there is an increase of people getting tested, due to which the results of RT-PCR test has been delayed to 2 to 3 days, sometimes more. Due to this, the symptomatic patients are suffering. They are not getting admissions in the hospitals for treatment, and this is increasing the load on the laboratories to give out test results as soon as possible.
The situation is the same in Delhi NCR. Long queues were seen at Delhi government-run hospitals for COVID-19 testing. Private labs reported a huge backlog of samples.
बट RT-PCR में टेस्टिंग करने में थोड़ा टाइम लगता है, 4 से 6 घंटे लगते हैं प्रोसेसिंग में। और इस समय चूंकि बिकॉज लोड इतना बढ़ गया लैब पे, नंबर ऑफ लैब्स हैं, बट लोड बढ़ने की वजह से टेस्टिंग की रिपोर्ट डिले हो रही है। तो कहीं ना कहीं टाइट जो है टर्न अराउंड टाइम है रिपोर्टिंग का वो बढ़ गया है। ये पहले जो हमें सेम डे रिपोर्ट मिल जाती थी, अब 2 से 3 दिन भी लग सकते हैं।
Anxious patients were even getting into fights over the delay in getting test results.
केवल 2 काउंटर चल रहे हैं और यहाँ पे ये पूरे स्टाफ आधे हैं और जो भी एक्सपर्ट जो फीडिंग करने वाले हैं वो भी एक उंगली से टाइपिंग कर रहे हैं आज के 2021 में।
Outside the Lohia Institute in Lucknow, restive crowds were seen outside the testing center.
कारण काउंटर का नहीं है, ये लोग सेटिंग करके अंदर रखे हैं, बंडल का बंडल आ रहा है। यहाँ पे हम 3-4 घंटे से लोग खड़े हैं लेकिन सुनवाई नहीं हो रही। बोलने के बाद से मैंने अभी हेल्पलाइन में नंबर कर किया, पीआरओ को भी कॉल किया था। सेटिंग करके रखे हैं, स्टाफ की क्या कमी है? वो पैसा लेकर के बाहर से ला करके पर्ची डाल रहा है।
The situation in Lucknow aggravated after several microbiologists and staffers at 2 hospitals tested positive, leading to the shutdown of BSL-2 machines for 48 hours.
हम लोग लखनऊ में पर डे 25 से 27,000 टेस्ट कर रहे हैं जो पॉजिटिव पेशेंट के कॉन्टैक्ट्स हैं। एक तो ऐसी पीजीआई लैब थी और एक बलरामपुर हॉस्पिटल में जो लैब थी, वहाँ पर हमारे डॉक्टर्स, माइक्रोबायोलॉजिस्ट और लैब टेक्नीशियंस जो हैं वो संक्रमित हो गए। उस वजह से उस लैब को जो है वो कुछ दिन के लिए जो है वो बंद रखा गया है। लेकिन जहाँ पर जो भी पॉजिटिव केस है, उनके जो कॉन्टैक्ट्स हैं, उनकी टेस्टिंग जो है जैसे पहले होती रही है वैसे ही अभी भी हो रही है। आम जनता में एक भय व्याप्त है, हल्का सा बुखार हुआ तो वो खट एक रिक्वेस्ट डालती है कि हमारे पूरे परिवार का टेस्ट करा दिया जाए।
The numbers are alarming in UP. In last 24 hours, 18,000 cases have reported yesterday, and now with this whole pandemic converting in the second wave, it is expected that more cases will come. Certainly, that's a big concern for the government. In Lucknow, with cameraman Sanjay Singh, Abhishek Mishra for India Today.
Big breaking news that's coming in. The Uttarakhand government has clarified that there's no question of shortening the Kumbh Mela. Remember that the Kumbh is expected to go on till 30th of April, another 15 days. And the Uttarakhand government has said that it will continue as per schedule. They will not shorten the duration of the Kumbh schedule, that it will get over on 30th April at Haridwar. There was a lot of talk about whether the government should go ahead and curtail this Kumbh, keeping in mind the rise in cases and the fact that authorities on the ground were struggling to ensure all norms were being followed. But now the Uttarakhand government has made it very clear that till 30th April as scheduled, the Kumbh will continue in Haridwar. More Moving on, let's focus on the state of Karnataka, which has also reported a record surge in the number of coronavirus cases. Over 11,000 new cases in the last 24 hours alone. That's been reported in the state of Karnataka. 11,265 new cases and 38 deaths in the last 24 hours. If you break that data down further, look at the city of Bengaluru. It's recorded as many as 8,155 fresh cases. With these rising cases, Karnataka's total active case tally stands at 85,840, out of which 63,167 cases were reported from Bengaluru alone. The Yediyurappa-led state government has decided to call for an all-party meet on April 18th to mull over the need for a lockdown amid the rising cases. Currently, there are night restrictions that have been imposed in Bengaluru, Mangaluru as well as Mysuru, among other areas. These curbs will continue till April 20th.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.